Well, welcome everybody. Karen Gibler with the Sarpy Chamber. I am here with Tom Greco with UNICO, who is a insurance provider, and we are going to discuss specifically on health insurance today. So welcome, Tom.
Thank you, Karen.
My first question for you today is if you could tell us about the industry and what as a whole has the health insurance been seeing in assisting with the COVID cases and how the insurance industry has changed as a whole.
Well, from the ideal lending is property casualty as well as on the health side. So they're kind of both doing the same thing. They're some of the companies are waiving the testing cost for the COVID testing that's being done right now. Some of the companies are putting in some safeguards on cancellations and late payments. As long as you contact the agent or the company, they're willing to work with you in regard to that. I think our biggest issue in the health industry, which we're not seeing yet, but we will see if this continues, is the layoffs of the employees no longer have health insurance. And what are we going to do about that point? That I do not have an answer for. I don't think anybody does. But that's an issue we're going to have to address in the next 30 to 60 days if this continues. We don't know how that's all going to. Right now, they're kind of giving us that continuity. But if this goes 60, 90, 120 days without any health insurance, the government's going to have to step in and probably reopen the Affordable Care Act, in my opinion.
Well, that's interesting because I was reading on the new PPE or program that they're having for the layoffs that part of getting the unemployment where it's not going against the business for filing unemployment is that they have to allow continued benefits. So that'll be interesting, and being able to see companies be able to sustain the matching portion of the health insurance. So we may do a follow-up with you in a month or two to see if that has changed the enrollment and what the impact of that is. So I know that's a big question and it's a big fear of a lot of the employees of businesses right now. It's unfortunate we don't have a solution, but we are in untreaded waters right now that we haven't been in before. So are you seeing less claims coming in right now with a lot of the dental and vision and non-emergency surgeries kind of being closed?
Well, absolutely, because right now, at least in Nebraska, the dental association shut down other than emergencies.
Yeah.
So for anyone that having to do checks and routine visits are not being allowed in any of the dentist office right now. So obviously that's going to be a lower claim activity. The elective surgery that were going out, they've been put on hold in a lot of cases. So that has lowered the claim count for sure.
Well, I can imagine when this when we release this and everybody is back to go in, everybody's going to be extremely busy. So
I think that's going to be in every industry. From restaurants, I can't even imagine the lines in the bar.
All right. Yes.
Wait for that day to open.
Well, we surely miss our face-to-face connections with our community and our membership. We're a very social group, and I imagine that's the same way for most of our businesses that get to have those personal relationships, especially the insurance company. You definitely build some close bonds with the people you do business with, and so we see people from your organization all the time. So
well, that's one of the things with our organization. We've shut down any entrance for the outside public to come into our offices, and we've stopped meeting with our clients. Yeah. Everything's done by either Zoom or by phone call. So we're trying to be proactive on that side of it, contacting our clients and finding out what's going on. But that definitely in a relationship business, that does change the dynamics on how you're dealing with your clients and not knowing what they're going through. With kids at home and the uncertainty Another part of the CARE Act was the fact is that employers were supposed to keep their employees and get the funds from the government. We haven't seen if that yet is materialized, but that was the whole purpose of that act, is to keep them on the payroll.
Right.
Thus, they would have their health insurance and whatever benefits they were having. So definitely uncharted waters right now.
Yeah, it's been interesting. We're really seeing the community come together and adapt as a whole in these changes. I know your organization has done many webinars and conference calls to the community on the day-to-day changes. And so kudos to UNICO for sharing that information and being on top of it. It's really helped the chamber be a good resource for this information. It's also been nice. You guys have been able to give us national information and not just Nebraska information. So we've been able to share a lot of that information and also being able to do this call as well. Are you having any projections on what this impact will have on the healthcare industry next year?
Oh my God, it's going to be, I mean, just think about the Medicare part of it that's affecting the senior citizens as well.
Right.
That the health rates have got to skyrocket. I mean, the amount of money that's going into this is going to show up next year. So yes, definitely rate increases, especially on the Medicare side, and the supplements definitely will be seeing an impact on that as well.
Well, do you have any words of advice for people that are concerned about their health insurance, or for any, I guess, insurance companies? Where do you encourage people to call or to find their information? And any advice to anybody that's
I think the best advice to give is, number one, their employer, especially anybody over probably 10 that's got an employee group plan, they have a human resource department that is on top of it. I know ours is. We're constantly getting communication every day on things that are being affected out there. The insurance companies, both from the property casualty side and the health insurance side, have really come together and has done everything they can in terms of giving advice, trying to make sure that if premiums are going to be late, that they work with the companies. I know in a lot of our companies, we have moratoriums on any cancellations, period. So even if you don't pay the premium, your policy is still going to be active. Okay, but again, what's going to happen in 90 or 120 days is continues. I mean, 30 days is a lot different than 90 or 120 days. So they've been really working together with the government to make sure that there's a continuity going on and continuing with both the property casualty and health insurance industry. I think the biggest concern that I have as an agent in our industry, and it works both sides, property casualty, health insurance, is government coming in and mandating coverage on policies that have exclusions. If we get into a world where the government could come in and say, yeah, we know that's excluded, but we're still going to have to make a payment, you're going to see the collapse of the insurance industry as it is today. And so we got to be careful that we don't get too crazy on making sure people are getting paid when they were never supposed to be paid in the first place.
Right. It's interesting. We're seeing that across industries of businesses being required to pay bills, and tenants or purchasers aren't required to pay, but somebody's got to pay.
It's a domino effect. I mean, it's okay for the governor to come out or the president to come out and say, okay, we're not going to have, you don't pay your rent for this month, but then that's the landlord of the renter. Well, then the landlord has a duty to pay his money to the bank. The bank has investors, so you've got this domino effect.
Yeah.
That where does it, I will say there's a couple things that are going to come out of this that's really going to make us better. One, the dependence on outside places to do business, like China. A lot of stuff will come back here, number one. And number two, do business with local establishments.
Yes.
They're easier to work with you than someone on a national level. So I think that's all going to come back and make it a lot stronger for everybody, especially the local economy, once we get to that point.
Yeah, it's been interesting. We've seen some really neat bonds being made, and we've seen a lot of support in different industries of helping local. And as the Chamber of Commerce, we've really been pushing that, and we're getting to talk to all the members and get some feedback, and it seems like it's really working well in our community. And so we thank all of our partners, in which UNICO is a partner with the Sarpy Chamber. You guys give us the ability to continue to be successful and do our regular outreach. And I want to thank you for your time today. I look forward to following up with you in a couple months, as I'm sure things will continue to evolve. So you have a wonderful day, Tom.
Hopefully the next call is going to be back to normal.
Yes, right. I look forward to seeing you in person soon. Thank you very much, Tom. Have a good day.
Thanks, Carrie.